systems change, passing policy, and securing the funding needed to address homelessness in Minnesota towards that vision where every single person has a safe and dignified home. I want to invite you to follow us on social media. We have a very active Facebook and Twitter accounts. Participate in Twitter storms and tweet chats throughout the legislative session. Build a relationship with your legislator. Sign up for our e-news on our website. Follow updates with Homes for All. Join our shelter supporter campaign, and mark your calendars for Homeless Day on the Hill on Wednesday, March 10th, 2021. We'll be making an announcement in the next month or so about whether that will be an in-person or virtual event. This event is made possible by our generous sponsors. Our leadership sponsors are the Department of Human Services and the Polad Family Foundation. Our champion sponsor, Open Your Heart to the Hungry and Homeless. Our advocate sponsor, Minnesota Housing. Our technology sponsor, Catholic Charities of St. Paul and Minneapolis. Our session sponsor is Frederickson and Byron. And we have some great grassroots sponsors as well, Hayes Company, People Serving People, and Simpson Housing. Again, thank you for your generosity and making this event possible. I just want to give a shout out to the MCH staff who are working behind the scenes to help make this event possible, and welcome our new Director of Public Policy who just started today, Zach Eichten. Just a quick reminder that you can check out our conference website to learn more about the upcoming sessions or even more about the session that we're about to jump into. And feel free to screen grab throughout the session using and tag us and use the conference hashtag. And as a reminder, this session is also going to be recorded and distributed in the future. To ground our work during this session, I wanted to provide a few statistics about homelessness in Minnesota. On any given night, there are about 20,000 children, adults, and seniors who are experiencing homelessness in Minnesota. About half of people experiencing homelessness are children or youth ages 24 or younger. Black, Indigenous, and people of color are significantly overrepresented in the homeless population and represent about 2/3 of those experiencing homelessness. LGBTQI folks are also overrepresented in the homeless population. And finally, homelessness exists all across Minnesota. About 1/3 of people experiencing homelessness are in Minneapolis and St. Paul, 1/3 in the suburbs, and 1/3 in greater Minnesota. Just a few housekeeping items as they relate to Zoom. Everyone is muted and the chat function has been disabled. We'll primarily be using the Q&A function throughout the session, and panelists will monitor that Q&A. And I'm going to share our first poll today. So wanting to know where everybody is joining us from, I'll give it about 15 seconds for you to respond to that. I can see that a lot of people are participating, so great. Yeah, we've got a really great mix of people across the state. I'm going to go ahead and end the polling here in about 5 seconds. I'm going to share those results with you. So it looks like we have folks from all across the state participating today. And so I hope you enjoy your session and thank you for being with us. So this is just a quick little preview of our session today with the Institute for Community Alliances. They are the HMIS folks, and they're going to be telling us more about how to turn data into insight about homelessness. But first, I would like to share a video with you from Commissioner Ho. Our Minnesota Commissioner has been an advocate for people experiencing homelessness in all of her professional years, really, and has provided such great leadership at Minnesota Housing to advance our collective cause to end homelessness in Minnesota. So I'm going to move over to sharing that video.
Hi, I'm Jennifer Ho, the Commissioner at Minnesota Housing. And I just want to say on behalf of the Minnesota Coalition for the Homeless Thank you to everybody who's participated in this conference. You know, these are challenging times right now. The pandemic is raging. A lot of families are hurting, and people who have been living outside and in shelter have had to make incredible sacrifices in order to get by during the pandemic. I am so grateful to the work of the Coalition for the Homeless in terms of your steadfast advocacy. You can't imagine how important it is to me and the work that I do, the governor and lieutenant governor, to have your voices working with legislators from all over the state to highlight how important it is to make investments in everything from shelter to, of course, a permanent home. So thank you for your work. I think that more Minnesotans than ever realize how fundamental it is to have a home during a period of time when we've been asked to stay there in order to protect our neighbors. And so I think as we've done incredible things in partnership to help make shelter socially distant and safer, how to help people who are living outside do so with dignity and getting the food and healthcare support they need, as we've had an opportunity to turn around an incredible federal infusion of money for additional shelter and safe spaces, as the legislature and DHS has invested so much in trying to make things better, we know we've got a lot of work ahead because we need to make sure that we can sustain the types of supports that we've put in place, make sure that shelter isn't something that's only open for a few months a year. So please partner with the Minnesota Coalition for the Homeless and help us get the resources that we need to prevent and end homelessness in Minnesota. Thank you.
Thank you for the commissioner for that video. Now we will kick off our second session of today with Emily and Selina from ICA. So you guys can go ahead and, I guess, take the Zoom.
Hello, everyone. My name is Selina Sun. I'm a project specialist with the Institute for Community Alliances, or ICA. I'm here today with my colleague, Emily.
Hi there, I'm Emily Salvaterra. I'm a data analyst at ICA. Happy to be here today.
So like Rhonda said earlier, we're here to talk about how to turn HMIS data into insight about homelessness. So just a quick overview of our agenda items today. So of course, we'll be talking about HMIS. So what HMIS is, we'll be talking about how you can use HMIS as a tool to advocate for those who are experiencing homelessness. What kinds of stories can HMIS tell? And how you, the advocates, can easily access this data. And at the end of our presentation, we'll go into a Q&A session to answer all the questions you might have. And so before we begin our presentation here, we would like to do a couple of polls. So the first poll, we would like to just get to know who you are and what brought you here today. So maybe you're a community advocate who doesn't work in or around the homeless response system, but are interested in participating in conversations around homelessness in Minnesota, or you work very closely with persons experiencing homelessness, and you're here to find out if there are additional resources that you can access for your clients. Or you don't work directly with the homeless community, but you do work with people who do. Or you're in other roles and you're just very curious about HMIS. So take your time with the poll. Give it another 15, 20 seconds. Emily, shall we end the poll and see where folks are coming from? All right, so we are seeing the majority of folks who work very closely with persons experiencing homelessness. Thank you for being here. There are also folks who maybe might not know HMIS very well, so that will take us into the second poll. Since this is a presentation on HMIS, we just like to know how familiar you are with HMIS. Maybe you work with it every single day. You log into Service Point first thing when you get to work. every day, or you work with people who use HMIS, or you don't work with HMIS or people who use HMIS, or you don't use HMIS, but you do use a comparable database to track the clients that you serve, or you have no idea what HMIS is, you don't use it, or a comparable database, well, this is the place to be. So give it another 10-15 seconds for the poll. Shall we see some results? Okay, so we're getting actually quite a few folks who don't use HMIS at all. That's great. Also, quite some folks who use it every day. Well, I hope you're not getting sick of it yet. Why don't we dive into our presentation today? So whether you are very familiar with HMIS or you just, this is all just brand new information for you, hopefully you can walk away with something very useful from our presentation. So HMIS, or Homeless Management Information System, is a database used by homelessness service organizations across Minnesota to record and store client-level information. It is a collaborative project of the state of Minnesota, the 10 Minnesota Continuums of Care, the HMIS lead agency, which is us, ICA, and the participating partner agencies. We, ICA, assumed the role of lead agency in 2016. And since then, HMIS has continued to grow and expanded in its coverage of homeless service programs, and beyond that to where it's become the tool for coordinated entry in all CLCs. We're going to show later in our presentation a very cool visualization tool that captures coordinated entry data and helps us understand how the system is working. So if you have no idea what HMIS is, of course, you would be very unfamiliar with coordinated entry as well, but Emily will briefly explain what it is in our second portion of the presentation. So Minnesota's HMIS has 1,000 users from more than 200 organizations providing homeless services and includes over 20,000 homeless beds over around the state. Programs in HMIS span the continuum of homeless services from homelessness prevention and street outreach to emergency shelter and permanent supportive housing programs. So speaking of what HMIS is, we have to talk about the data the system collects. So HMIS data can be broken down into 3 general categories. So there are identifiable client data, provider data, and transaction data. So identifiable client data or client level data, this is the data that gives us the ability to understand how individuals are moving through the homeless response system. Transaction data. Now, if you use HMIS, this is what you know as the entry exit data, the service transactions that you record for your clients. So this is the data that gives us the ability to understand how the system functions altogether. This is where you can see how much resources, how much housing resources are available, and how much of it is utilized by your clients. And provider data, this is data collected at agency level. This data gives us the ability to understand the effectiveness and the operations at the agency level. And it's important to note here that some agencies do use HMIS as their primary database of record. So all of this information is interconnected since October 3rd, 2016. It's also being shared statewide. Data sharing is governed by client consent given via Minnesota's HMIS release of information and pertains to data sharing between partner agencies within HMIS. It was implemented hand in hand with coordinated entry in Minnesota and is an essential piece of coordinated entry's functioning. There are some agencies and situations exempted from data sharing, notably minor youth serving agencies, agencies that serve survivors of domestic violence, and the data of any client who does not consent to sharing. Finally, it cannot go without saying the database is only as good as the information that comprises it. Without the work of more than 200 agencies and their staff to enter the data and the consent of the clients, HMIS would not stand out as a strong advocacy tool. Now you might want to ask, how can we effectively use this data without maybe drilling through an extensive R report if you use HMIS? Or you might say our agency doesn't participate in HMIS at all, but we would still like to see some of this HMIS data because we do serve individuals at risk or experiencing homelessness. I don't want to tell you, yes, there are publicly available HMIS data dashboards that demonstrate this HMIS data that I've been talking about. They are developed based on HMIS data collected by all kinds of service providers statewide. The data shown through the dashboards can give pulse point of system performance and demographics of those served. There are various dashboards that you can use for different purposes, but in this presentation, we will focus on the monthly system performance dashboard and the coordinated entry dashboard. Now, Emily will pull up our monthly system performance dashboard, which lives on our website. So right now, so it's defaulted to the current month, which is the latest monthly data that is available, which is showing the data for the month of September. So you can see this is given a very high level monthly snapshot of who were served in the homeless response system statewide. So you can see the basic demographics of these individuals, the gender, the age of the persons experiencing homelessness in Minnesota in September, the share of them who are veterans, the percentage of those who are identified as chronically homeless. Now you can also see the racial breakdown of who are experiencing homelessness statewide. And you can see that the African American and Native American communities are disproportionately impacted by homelessness in Minnesota. So beyond the demographics, it also shows you the number of people who are recorded as newly homeless or first-time homeless, the number of people that exit out of the system into permanent housing programs, and the number of people who had previously exited out to permanent housing programs, but now have returned to homeless response system in September. So this is all based on client level data collected in HMIS that I was describing earlier in the presentation. So this dashboard, the current view is defaulted to statewide data. So if you click on the dropdown, you could select a different COC, depending on maybe you're interested in the data where you work or live in. And so if you scroll back up in the dashboard, you can see there's a historical tab. So if you click on the historical tab, there are charts that show different trends over time about the homelessness in Minnesota. So right now, so it is defaulted to the total number of clients served. So you can see the total number of clients served between the month of January and September of this year, staying fairly steady. And then if you select exits to permanent housing in the drop down, we can also see this consistent drop in the number of exits made out to permanent housing programs. So we can definitely see the impact of the pandemic on the homeless response system and individuals experiencing homelessness. And that is, the pandemic has made it very, very difficult for people to successfully exit the system and find permanent housing resources. So now that you've seen this high level snapshot of who is experiencing homelessness in Minnesota and what is happening as they navigate through the system, Emily will take over and walk you through the coordinated entry dashboard to get a closer look at the population experiencing homelessness, in particular who are participating in coordinated entry system to be more effectively connected to permanent housing resources.
Thanks, Selina. We did have one question come through that I'm going to go ahead and answer live. And just a note here that folks are, while we do have a set aside time for questions at the end, you're more than welcome to type questions into that Q&A box as we go. And we'll, depending on kind of how our flow goes, we can take them as we come in or answer them later. But since I've got the dashboard pulled up and Heather asked a question, noticing that it looks like gender only has 2 categories. So wondering if data is collected for transgender, non-binary, or other gender diverse people. And the answer is yes. So data is collected for, folks have the option to select those categories among the gender category. And while they're just represented in very small kind of slivers in this chart here. So it's not so easy to see, but it is there. And yeah, thank you, great question. All right. I'll take us back to our PowerPoint presentation here. And Selina mentioned, and we've used this term a number of times, we're going to talk next about the coordinated entry system data, which is another set of publicly available data that's on that HMIS MN website. So data in this dashboard and data that represents coordinated entry overall is really focused specifically on clients' experience in that system. We're going to go into more detail about what that is, but also just sort of wanted to explain the relationship between coordinated entry as a system and the larger homeless response system. So when we're focused on coordinated entry, we're considering one portion of the larger homeless response system. And so important to remember that that's just one piece of sort of this larger donut that is the homelessness response system as it's represented in HMIS. And also that even though HMIS does represent a good portion of persons who are experiencing homelessness and the programs who serve them, not every program that serves people who are experiencing homelessness is in HMIS, and not every person who experiences homelessness is in a program. So this, while our system is robust, it doesn't represent the experience of every person who might be homeless in the state. So next, again, as we keep promising, we're going to dive into this coordinated entry system data. But first, we're interested in hearing how familiar you are. How familiar our audience is with coordinated entry. So we'll launch another poll here. And yeah, curious to know, especially among folks who did share with us that they use HMIS, whether that has also kind of gotten you a lot of familiarity with coordinated entry. It could be that maybe today is among the first time that you're hearing that phrase, or if you're an active HMIS user, active person working in the homeless response system, you might know so much that you could say that you wrote the book on coordinated entry. And again, our goal is kind of no matter your level of familiarity, that we'll have some good information to offer you about the system. We'll give it just a few more seconds here. And then go ahead and close this poll and share the results. So though I would guess that there are a number of you who could write a book about coordinated entry in our audience, not many who are admitting to that level of expertise. And we have a number of folks, our large majority of people are somewhat familiar with coordinated entry as a system. So that's perfect. Thank you for participating in our poll. So as an introduction for those who aren't so familiar, or kind of a reminder for those who have at least kind of somewhat of a level of familiarity, coordinated entry is many things. It's a system, it's a tool, it's a process, and it connects people experiencing homelessness with the best available intervention to end their homelessness in the least amount of time possible. Coordinated entry systems or processes have 4 main components, and those are access to resources, assessment of need, prioritization according to need, and then referral to resources. Each continuum of care, and that's a term I don't think we've defined yet, that's the Department of Housing and Urban Development's sort of term for a different region. Each continuum of care in Minnesota operates its own coordinated entry system. And to understand how coordinated entry is working statewide and within each continuum to accomplish its goals, ICA maintains this public-facing data dashboard. It contains data on key coordinated entry system metrics meant to help communities understand whether their work system is working effectively, who it's serving, how those people are being served. Coordinated entry data in particular can help us tell really important stories about the needs of people who are experiencing homelessness in a given community. It can tell us about who's accessing those resources and how long it takes them to get them. And it can also tell us whether different people have different experiences in the coordinated entry system. So to demonstrate those kinds of stories that publicly available HMIS coordinated entry data can tell, let's go to that dashboard. So while it loads, the coordinated entry dashboard, as well as the monthly system performance dashboard that Selina shared, these are both available on the HMIS-MN website, and we've got a number of links later on in our slides, so you'll have access to those. Important to note, though coordinated entry has been around in Minnesota and represented in HMIS for a number of years, this dashboard that we're going to show contains data that just starts in March of 2020. And that's because as a state, we made a big change in how we record coordinated entry data in HMIS at that time. Though also data from prior to March 2020 is available. There's an exact replica of this dashboard that contains data from prior to that workflow switch. And that's also available on the HMIS-MN website. So this dashboard and the monthly system performance dashboard, they're both built in Tableau, and they contain a number of those features that are common to dashboards built in that tool. You might be familiar. Tableau's even kind of got a common color palette. So I think folks are becoming more and more familiar with Tableau tools. One of the kind of common features is the ability to filter the data. This dashboard has a number of filters, and this one in the top right here is giving you the ability to filter by time period. So the report start is sort of the base time period that the data that comprises these charts is coming from. And then you also have the ability to select a comparison period, which in the charts that have a bar going this way, that is the indicator for the comparison period. And we'll just leave this at the default here. So we're comparing the previous 2 quarters of coordinated entry data to each other. So our base period is from July through September, and then that comparison is April through June. There are also filters and details that are available to select when you scroll all the way to the bottom. So here you have the ability to select one or more continuums of care. If you're interested in particular county level data, that's also available. So if county is the geographic unit that you're interested in, you can filter that way. You can select one or multiple household types that the persons active in the coordinated entry system represent. You can filter to only persons who meet the federal definition of homelessness, or you can see all persons within the system. And then you also have the ability to select a detail here. So when you select the race detail, or any of these details, then the charts break down into different parts of the whole, according to how clients indicated their race, ethnicity, gender, veteran status, disability status, and so on. So not all of the charts on this dashboard have the ability to have that detail applied, and you can tell where they do by the different colored bars appearing. So these charts that all the bars remain gray, that means the detail can't be applied there. So now that we've got a little bit of an orientation to how this dashboard works, I'd like to walk through in particular some stories about coordinated entry and system performance that this dashboard can help us tell. And I'm going to do that on the next tab of the dashboard, which is called the time tab. And all the charts that are here, the unit of measurement is time. So they all represent the average number of days that it takes people to reach different milestones within the coordinated entry system. And that's where we'll kind of dig in deeper. So we can use this tab to find out how long it takes to reach those different milestones in the coordinated entry journey. We can see who reaches those milestones faster, maybe who's not reaching them at all among people who are in the coordinated entry system. And so just to start, to get us kind of digging in here, we'll start with just a statewide look at all persons in the system. So that's how the dashboard defaults, is with none of the sort of filter or detail applied. This first chart is showing the average number of days that it takes for a client to receive a referral to a housing project. And it measures between the days between a person's entry into the system. So when they get to those access and assessment elements of the system, measuring from there to referral to a housing project. And you can think about that as the prioritization and referral piece of the system. I can see here that it's just counting among clients who have received one of those housing referrals. And I can see when I hover here that it takes, on average, for all clients in the system, among those who have a referral, around 172 days between when you first enter the coordinated entry system and when you get a housing referral.
Emily.
Yes.
It might be too small on the screen. Some folks can't
Okay.
very clearly. So I don't know if you could zoom in a little bit.
I can try.
Yeah.
Oh yeah. Is that better?
I think so.
Maybe a little better. Okay.
Yeah, that's
Thank
perfect.
you. Great. Okay, so zoomed in, yeah, absolutely can see a little better what's going on here. So the black bar on each chart is representing the average for the whole group in the period. And then when you hover over, you can also see just some additional detail and also the number of clients that this applies to. So here I can see that nearly 1,600 people statewide received a referral to housing during just this past quarter from July through September. Then this next chart is measuring the average number of days from a person's entry into the coordinated entry system again. So from that same starting point to an entry in a housing project. And this is just among those who have left the coordinated entry system and entered into housing. So when a client has an entry into a housing project, important to note that that doesn't necessarily mean that they have the keys to an apartment and that they're moving in that day. But what it does mean is that they have accepted a referral and begun a relationship with a housing program. I can see here that that takes on average 140 days. And that was true. 413 clients reached this milestone during this report period. So from here, I can see that not all persons who receive a referral are necessarily exiting with a relationship with a housing provider in the same time frame. And sometimes that's because it just takes time to process a referral. So that exit to the housing program might show up in the next report period. It also can mean that not all referrals are successful. So not every referral is going to necessarily connect directly to a housing project. And in the next chart, so I can see here, there were 413 people again who reached this milestone during the period. And then the next chart is showing me about people who reached the housing move-in milestone. So these are folks who really did get the keys to that apartment and moved in during the time period. And that was true for 308 clients statewide. This does take a little longer. And it takes on average 163 days. And sometimes for folks who work in the system, if you're familiar with, and really depending on the program, it could be housing search. So perhaps you have a voucher for a unit and it just takes some time to find the unit that's right for that particular client. Getting paperwork in order can also take time. So it takes on average around 25 more days to get, again, from the very beginning kind of point in the system, your entry into the system, to that housing move-in date. And also worth noting, I can see here that this takes on average less than the amount of time it takes to receive a referral among all the people who receive a referral. And that, again, is just an indicator that not all referrals are resulting in housing. So not all folks are getting from this point to these next 2 points. Then finally, we can see in the chart on the right here, the number of days on the priority list or active in the coordinated entry system for those who didn't exit during the time period. You can see here that's almost 300 days. So these could be people who had a referral, but it wasn't successful. It didn't result in housing. It could be a referral that's still processing, or they could be folks who haven't yet received a referral at all. There are 8,237 of these people who were active in the coordinated entry system, hadn't yet left the system as of the end of September. So the next thing I want to do is repeat these same steps and kind of go through these same pieces of analysis with detail applied to show the race of the clients. And I'll focus specifically on persons who identify as Native American who are in the coordinated entry system. And on these charts, they're represented in purple. So if first I'm interested in the time it takes for Native American persons to reach these milestones compared to all clients on average, I would look at the purple dot and its relationship to this black line, which is showing the average for clients overall. In each chart, I can see, well, first I can see that it takes Native American persons less time to receive a referral compared to the average overall, because this dot is below the black line here. But it takes longer for persons who identify as Native American to reach housing project entry than the average, and actually a good deal longer to reach housing move-in than the average clients. And it also takes longer, Native American clients spend more time on the list, active in the coordinated entry system than the average for clients overall. If I'm interested also in comparing the proportion of Native American persons in each group, I can do this by looking at the size of the dot relative to the size of the other dots in the chart, and also hovering over it to get that additional information. So here I can see that Native American persons made up 14% of people who had a referral during the time period. But when I look at project entry and housing move-in, persons who are Native American make up just 9% of that overall population of folks. And I can see that 12% of the people who stayed on the list, who were still active in the system as of the end of the time period, were Native American. And so what does that mean? What can we kind of make of that? It suggests to me these proportions and specifically that Native Americans make up a larger proportion of folks getting a referral than those who are moving on to those next important milestones. That suggests to me that Native American clients were not connected to housing with the same level of success as other groups. We can again kind of take this another step further by examining these same elements, specifically in regions where people who identify as Native American make up a larger share of persons in the coordinated entry system overall. And as a note, we can find out which regions those are by the clients tab. We've already taken that step, so I'm going to go ahead and just select a couple of regions here to give us that ability to drill down a little further. So now when I'm looking specifically filtered just to a couple of regions of the state of Minnesota, I can see that in terms of time, Native American persons who are reaching these milestones are doing so at roughly, actually in every case, less time than it takes the average overall group of clients. So since the dot is below the average line on each chart, I can see that it's taking Native American clients less time than the overall group of clients to reach each milestone. But I can also see that the proportion of persons entering housing programs and moving into housing who are Native American are smaller than the proportion of Native American persons on the list overall. I can do that again by hovering over here and comparing, also by looking at the size of that dot. So this was true statewide, and we're seeing it true again when we drill down to these particular regions, that the proportion of Native American persons who are getting to housing project entry and move-in is smaller than their proportion in the population overall, which again suggests that Native American clients were not connected to housing with the same success as other groups during this period. So I want to take a moment kind of before we move on to acknowledge that what we're presenting here, what we're demonstrating is just information. So we're not necessarily walking through the action steps that you might take once you learn this information. So our goal as the lead agency is in creating these materials is to give communities these tools to help them make sense of lots of complex information, and then partner with them and rely on them and their own expertise to take that action. And that's because different communities might see this data and then move in different directions based on what they know about their system. You as an advocate might see this data and take different action steps based on what you know about your legislator that you're sending that email to, or the people who follow you on Twitter and what they might respond best to. So that's why we leave it at presenting the information and then that partnership. And we know that what to do next after getting some illuminating information like this, and knowing what the right next step is to take can be hard. And we do trust that smart advocates like you who are in the audience here today are exactly the right partners for figuring that out and for taking those steps. And to do so, in addition to these tools that we've demoed, we want to make sure that you have access to all the different ways that you can reach publicly available HMIS data. So here's the link to all of our public facing dashboards. In addition to the system performance dashboard and the coordinated entry dashboard, we have a couple others. For whether or not you are an HMIS user, you have the ability to make custom requests. If there's information in particular that you think can really help tell the story of homelessness in your community and make a compelling case to the folks who do the decision making, and you don't see that information publicly available, you can make a request via a form on the HMIS-MN website. Those of you who are HMIS users have access to a library of reports that pull information directly out of the system. And this is just a link to all of the reports that are available within the system. And then I also want to take a moment to actually take us directly to the website and show you this page. So this series of statistics on homelessness in Minnesota, this is as hot off the presses as it possibly could be. This information was just updated this morning for data from the calendar year 2019. And it is offering just a number of different data points, sort of sound bites that you might be able to use in a fundraising letter or a tweet or that email to your congressperson that we think help to tell the important story that's represented in HMIS data. This portion is talking about the proportions of people across the state who experience homelessness. So this is comparing data from HMIS to information from the census. We also have some information about the demographics and particular experiences of people in the system. And then I think this is a really neat series of charts about permanent housing capacity in our state. This was some analysis that was done nationally by the National Alliance to End Homelessness that we replicated for the state of Minnesota. And it is showing us that in the year 2019, based on the number of people who were sheltered or unsheltered homeless, and what we know about our permanent housing capacity statewide, for all people experiencing homelessness, there was capacity for around 34% of those folks. And the good news is that there was a great deal more capacity for families experiencing homelessness. So the system had capacity for about 83% of people who are homeless who are in families. So without going maybe too far deeper into this page, I would just really encourage everyone in the audience to take a look at this as sort of a first jumping off point for publicly available HMIS data that's already, or hopefully is kind of ready to use already. All right, so that brings us to the end of our kind of official content. We want to open up the time for question and answer. Also mention that we've got our contact information up here. So if you are later on in the afternoon even, or later into the future, you start digging into those dashboards and find that you have a question about how to interpret what you're seeing, or if there's more information that you'd like to see, you're more than welcome to reach out to us. We'd be happy to hear from you.
Did you guys want to wait a few moments and see if there are more questions and answers or questions that come in that you'd like to answer?
I think so. Is that okay, Rand?
Okay.
Are we okay?
Yeah, that's great.
Yeah, a request to put the slide back up that's got the links. I can leave that right here.